פסיכולוגיה קצת יותר נחמד, ואני מזמין את שמחה שלדון, ידידנו, שהוא פסיכולוג קליני, פסיכולוג רפואי ומאבנן, להציג את העבודה שלו, שימוש בהיפנוזה והיפנוזה עצמית כטיפול בטיפול מיני. אני מקווה שהוא לא יאפנף אותה וכולם אותם.
עד שאתה מקווה שמה? בוקר טוב, ואני רוצה להגיד לכם שאני מאוד מאוד שמח להיות פה, לדבר איתכם על השימוש של היפנוזה עצמית בטיפול תפקוד המיני. כמו שאתם שומעים, המבטא שלי זה מבטא אמריקאי, בשפת שלי אנגלית, אז ברשותכם אני רוצה להמשיך באנגלית. אני עובד בארץ בעברית, אבל יש לי רק כמה דקות לדבר איתכם, אני אדבר באנגלית, אבל השקופות שלי הן בעברית לעזור להבין. During the last 30 years, I've been specializing in the use of hypnosis into behavioral medicine and psychology. And I have to say that I'm so happy that Dr. Abramov and Dr. Lurie spoke before me today, because hypnosis so much speaks to what they spoke about. I wrote down, Dr. Abramov said, "Hakol talui al matzav ruach." ואני רוצה להוסיף לזה, זה גם, actually I'm speaking Hebrew now. I want to add to that all the things that are going on in the mind cognitively, as well as emotionally, affect very much the sexual response. And I also want to say regarding what Dr. Lurie has said, that the technology that they are using in terms of CBT, in terms of desensitization, in terms of dealing with phobias, when you're working with patients who are in hypnosis, those psychological techniques tend to work much more quickly, more deeply, and are very, very effective, sometimes more effectively than not with hypnosis. Now, hypnosis can be used both for things that are psychological, meaning psychosomatic or psychogenic in nature, but also hypnosis can be used specifically to change the physiological response in the body. And still today, some people think, well, is hypnosis real or not? Well, the studies have come and shown very clearly that through fMRI and PET scans, that hypnosis is very, very real in the brain. I'd like to share with you a few reasons why I think that hypnosis as a treatment should at least be considered. And I know that at these programs, there are a lot of discussions about the usage of drugs. And I have to say that, of course, drugs have their place. But I think we all agree that if you can do something as effectively without the tufot levai that you have with medication, adif. So hypnosis can facilitate positive results in a short period of time. Hypnosis is not invasive. It practically never has any negative side effects. There are no additional expensive costs of medications and expensive medical procedures. The use of self-hypnosis with patients helps the patient to feel a partner in the treatment, helps increase self-esteem, helps increase self-mastery, and there are lots of added benefits that come naturally with the use of hypnosis that the person can use for the rest of their life in a variety of other areas. I'd like to say that this is not really machkar, and you can look at NIH studies, you can look at the Mayo Clinic. Hypnosis is used widely, not that much in Israel, but widely in other places for sexual therapy. Now, I also want to say that there are some cases where hypnosis is contraindicated. We don't have time to talk about that today, but for the most part, hypnosis is a very appropriate procedure to use. What is hypnosis? Well, there we go. The truth is that there isn't a scheme about what hypnosis is because nobody really understands exactly how the brain works. This is the definition of hypnosis of the Urdun Mahatmatim Po Ba'aretz. And basically, briefly, I will tell you that hypnosis is a lot of different things. Some people think it's deep relaxation, but Olympic athletes use it for focused concentration and stamina. Hypnosis can be used to focus on certain things, to not focus on other things, which you can understand why would be very important for good sexual function. Hypnosis is used in pain management. Hypnosis is used to use your creative imagination to create phenomenological experiences cognitively, emotionally, and physiologically in the body. So I'll talk a little bit more about what you can actually do in hypnosis. I'm putting an 1.5 to 2 hour lecture in just a few minutes for you, so I have to speak quickly, and I apologize for that. Okay. I want to talk about some of the things hypnosis is used for as a tool in treatment. Okay, it's used as a kli choni. What does that mean? That means that oftentimes a person can go to a urologist, to some other kind of specialist, and not find an answer, not find a cause as to what's going on. In hypnosis, you can ask the patient to ask the tat-muda, and that's one of the beautiful things about hypnosis. Things that are unconscious become conscious regarding phobias. Sometimes a person might come for treatment for a phobia, but sometimes a person might have a phobia and not know it because they repressed it and it's keeping them from functioning properly. Okay, so you can ask somebody in hypnosis to ask their subconscious mind, is there something going on completely non-organically? And you can get even idiomotor signaling where a finger will lift to answer yes, and the person consciously might say no, but it might be a repressed trauma that happened when the person was 3 years old. Okay, direct removal of symptoms, indirect removal of symptoms. Indirect meaning, let's say the person suffers from a phobia, having relationship difficulties, has self-esteem difficulties, is embarrassed. Well, you can use hypnosis to treat these issues so they don't interfere with your good meaning. Okay, facilitation and enhancement of physical, cognitive, emotional, and specifically sexual responses. You can have a person in hypnosis, l'dugma, be able to call up in their memory the best sexual experience they ever had, associated to where they are right then, where they could use hypnotic rehearsal in terms of practicing in hypnosis, having positive experiences, so that when they get into bed with their partner, they already feel more comfortable. Discovery and resolution of psycho-emotional conflicts. Let me move on to the next slide. Resolution of secondary gain issues. Secondary gain is a very important thing to look at in treatment of sexual dysfunction, and hypnosis really can help understand from tat-muda what benefit your patient might be getting out of having a sexual thought. It might be, for instance, using it as a power dynamic in the relationship. The elimination and reduction of fears to improve self-confidence as an adjunct to standard medical treatment. Those of you who are surgeons probably know that hypnosis for pre-surgical preparation tends to decrease bleeding, swelling, and need for chemo anesthesia, and facilitates faster recovery time. Okay, as an adjunct to, whoops, I'm sorry, there we go. As an adjunct to behavioral therapy, as I mentioned before, many of the things that Dr. Luria shared with us this morning can be much more quickly facilitated when using hypnosis as part of psychotherapy. And I'd like to mention just for a moment the relationship of hypnosis and using sex surrogates. Oftentimes the use of hypnosis in terms of hypnotic rehearsal and learning how to actually experience things using your creative hypnotic imagination can really eliminate the need for sex surrogates. And in such cases, I would say it's adif for the patient to learn how to have positive functional relationships with actual partners who they care about in life. To stop negative hypnotic states. Now, this is a very important thing. Most of the people that come to me specifically for hypnosis, the truth is that they come in a negative hypnotic state. They had some trauma, they were rejected by somebody, they had chas v'chalila, a rape or sexual abuse growing up. And so what happens is when they enter a present sexual experience, they spontaneously go back to that trauma, re-enter the trance, not even knowing it, and respond in the same way. So a lot of what we do in hypnosis is we have people come out of their negative trances so they can continue to function in a healthy, natural way. Okay, here is a list of hypnotic phenomena and strategies used in treatment, time regression, all kinds of things. Obviously, we need about another half an hour at least to talk about that, so I'm going to move on. Okay, things that we can do with hypnosis in terms of what kinds of things we treat: erectile dysfunction, premature ejaculation, dyspareunia, vaginismus, pelvic pain, PMS, lack of desire, lack of attraction, insecurity, anorgasmia, infertility, that's a lecture in itself, painful intercourse, course, unconsummated marriage, lack of pleasure, fear of intimacy, performance anxiety, bad communication difficulties, infidelity. Looks strange to be on this list, but I have a reason that I can't talk about now, maybe later. Herpes and things like that. Okay, I'm going to skip here because of the amount of time. I'd like to speak now about some interesting case examples. So you have a little bit of a taste. So I look at the clock. Good. Quick case examples to give you an idea. Erectile dysfunction. A very nice young man in his early 20s came in with erectile dysfunction, addicted to Viagra. He said to me, Dr. Sheldon, and this is the truth, he just sort of wanted to be a super sex machine, and he didn't want to be afraid of not being able to function. In hypnosis, what came out was very interesting. He didn't have a fear of failure sexually. He had a fear of rejection because he was blasted and put down by the first woman he had sex with. And what happened, which was so interesting, is this guy who came in trying to be like Mr. Macho Man was really this sweet kid who in hypnosis realized that he used his problem of his fear, which kept him away from women, because he was hanging out in bars just screwing people who were on drugs for no particular reason. And so when he came to realize this, that he really didn't want to be super sex machine, but he wanted to have a loving relationship, we worked on that. He fell in love with a woman, didn't need Viagra, everything worked just fine. Another example of vaginismus and dyspareunia and a lack of desire for sex with her husband. Very interesting case. This is a person who went to a variety of programs in Israel, and doctors, etc., couldn't figure out what was going on. In hypnosis, it was revealed that when this woman was a young teenager, she with her friends watched a porno movie that they thought was fun. And she remembered laughing hysterically, but realized in hypnosis that she was really traumatized and developed then a negative reaction to sex and to men, and subconsciously decided to punish all men who rejected her in her younger years, including her husband. And upon realizing this from the Tankuda, we were able to heal the trauma, get a positive picture of what sex is, making love, and not just having a porn movie. Sorry about that, but okay. No. Another example is dysfunction of herpes. A young man came to me with herpes, and it turned out this is an example of secondary gain. It turned out in hypnosis that he had a hard time saying no to women, and he had a hard time asserting himself. He had no assertiveness, he had no self-esteem, and he used herpes as a reason to be able to say no. And so we used hypnosis for stress management, which reduces outbreaks, and also to elevate his self-esteem and assertiveness, and he stopped getting outbreaks. Another very quick example, which is very interesting. A man and his wife came to see me. He had premature ejaculation. They also went for years for all kinds of tests, couldn't understand what was going on. I don't know why. I happened to pray in the middle of my sessions to ask for guidance, and something came to me. I want to hypnotize their wife and ask her talking about if she has some idea what's going on. It was amazing. It turned out that she was sexually abused as a child. He was a romantic guy, and he could only function sexually if there was love and romance in bed. She decided when she was abused by her family sexually as a child that sex and love don't go together. And therefore, he couldn't be patifkud with her in bed. Unfortunately, in this particular case, she did not want to deal with that trauma, and I don't know what the ending of that story is. Another very quick example is a man who had erectile dysfunction. And it turned out in hypnosis that the reason was he felt guilty as if his first wife died from cancer. And he felt guilty that he was having an affair even though she was already dead. I just want to say that very oftentimes, the reasons why we have problems with our sexual function has as much to do with our heart and as much to do with our head as it has to do with our bodies. And I think that hypnosis is a wonderful way to help people get in touch with who they really are deep inside, to be able to relate in a very loving way, and also have a lot of fun in bed at the same time. Thank you very, very much.